Hello and welcome again, my friends. This is the Swift Half with me, Christopher Snowdon, a half-hour chat with somebody that I know or someone I'd like to get to know better, somebody I'd like you to know a little bit. And our only promise is it's going to be a half-hour informal chat, talking about whatever our guest wants to talk about. And this time, I'm very pleased to be welcoming Freddie Sayers, who is the executive editor of UnHerd. And UnHerd has really come into its own, I would say, particularly in the last year with its coverage of the whole coronavirus issue. And Freddie's very much been at the forefront of that. They've had every part of the kind of debate on there, every element, every part of the spectrum from, they've had Neil Ferguson on quite early on, one of the few interviews he did at that time, long form interviews. Then I've had people like Carl Hennigan. They really have, given people the full range of options, as it were. So, Freddie, hi, how are you doing?
Hi, I'm well, thanks. Thanks for having me. I'm just admiring your studio here.
It's not quite as professional as yours. I would like to have your kind of backdrop. Well, it's it's quirky, isn't it? It's quirky. It's my office.
Like it. Yeah.
So over the last, it's more than a year now. You're going to be getting on for 18 months quite soon. You've heard pretty much every argument, from kind of fairly extreme lockdown skepticism to fairly extreme zero COVID. Where's your head at with the whole thing now, personally?
Yeah, I mean, I guess I would already not like the kind of pro or anti-lockdown division that it sort of seemed to emerge into pretty quickly. I mean, if I had a position, it would be that we could have done more questioning and more creative thinking at the beginning, before it became this binary: either you're in favor of a kind of mandatory stay-at-home orders for everybody, or you're a kind of psycho who wants everybody to die. I felt like there might have been other options, and actually, considering the number of countries out there and the size of the stakes, I thought people were surprisingly unimaginative and surprisingly kind of censorious about different options being talked about. So I don't have a third way to present, but I always felt like there was something about the universality of those measures that I didn't like, and especially now that they've gone on so long. And so I felt like more flexibility and a bit more of a kind of sophisticated solution, given that it's been there for such a long time, might have worked. Is that a politician's answer that fails to land a blow?
Well, no, looking for a third way, not sure. Who knows what it is? I mean, it's my issue with the whole thing, in a way, is, well, not the whole thing, but one aspect of it is that there hasn't for quite some time now been a sort of a sane lockdown skeptics movement. That it very quickly veered towards a sort of, for want of a better word, denialism. My theory about why that is that although you can make a case, I think, on cost-benefit grounds for lifting restrictions, you can certainly do that now, and you probably could have done in January. I don't think I would have agreed with it, but I mean, it's possible to do that. We can try and put a value on life and liberty and balance these things out. But very, very few lockdown skeptics have really tried to do that. And I think the reason is that they don't want to be presenting the public with, we're accepting that X number of people are going to die, and that is, in our opinion, an acceptable price to pay. And so rather than do that, they've told themselves various stories that means that result in them concluding that there isn't a trade-off to make at all. And so lockdowns do work. So obviously you wouldn't do a lockdown. And the number of people who die is totally unaffected by anything government policy does. And that's my theory anyway. It seems to me that they're not prepared to grasp the nettle and say, look, people die all the time, and that's the trade-off here. But we just think the government should be going in the other direction because we value these other things more, which is a respectable position to make, but they don't really make it.
It's not just the lockdown skeptics that are not doing that. The government isn't either. Everyone's been waiting for the government to come out and say, with what level of cases would be acceptable, what number of deaths would be acceptable, and obviously they're politicians, they don't want to do that either. The kind of falling, the story of the lockdown skeptics in the past year will kind of go down in the annals as one of the, I'm afraid, great kind of failed political movements. It had occasional moments of energy, I would say, but it was very successfully opposed. And I think about that sort of Great Barrington Declaration moment, for example, in the autumn. And there was definitely a week or two there when I think it looked like there was, maybe that there was going to be momentum on this side. But I think the authors of that overplayed their hand. The proposal they made didn't sound sensible. It sounded reckless, and it could have been couched differently. And it was easy to caricature, and they lost. And I think on the constant wars that we witness on Twitter every day, and mercifully most normal people are kind of more further away from, it became this kind of tribal thing, and as you said, you get pushed to more and more extreme arguments. So I think that's what happened to the lockdown skeptics, the sad demise of the lockdown skeptics. I say it's sad because I would have liked to. I feel that throughout this last year, we should have had a grown-up discussion about it, basically, and rather than this constant desire to paint the opponents as dangerous or crazy. Clearly, they're hard issues, and I think if people had felt more comfortable putting themselves out there with ideas or queries, we might have had a better solution. Fewer people might have died, and we'd be in a better position. So that's my bold contention.
Is that what you think it went wrong round about, was it September when the Great Barrington Declaration came out? The fact that was like pilloried so much, even though in a sense that was the moment where if it was going to get traction, it would have been then, because the vaccine was still in.
I think it was November.
A lot of people assumed it would be a lot further in the future.
That's right.
It turned out to be.
I think.
Do you think once that fell, and then some of the lockdown skeptics got a bit more nutty, that was the end of it, really?
I think November was really the month when it sort of ended, because first of all, Trump happened, or didn't happen, and he was a lot of the kind of energy for questioning lockdowns and stuff came from Republicans, so that was a big moment. The vaccines were announced, I think both of the big ones were announced in November, and that was really the kind of that was the end of the argument, really, because if there was going to be a sort of certified end, we now know, sadly, that isn't necessarily a certified end, and other new threats have emerged, and the story might go on longer. But at the time, it was presented as the kind of the end of the story was going to happen in the spring. Therefore, it's worth struggling on for a few more months. Yeah, I think September, November last year was when it was curtains for the lockdown skeptics.
Yeah, and are you still concerned about the future for liberty? Because I know we spoke a couple of months ago. I mean, I'm concerned about the future for liberty, all the time anyway. And of course, I'm very concerned when I hear this stuff about vaccine passports and this kind of never-ending new normal. Are you a bit more sanguine than you were earlier in this lockdown, or do you think actually things are worse?
I confess I have sort of mood changes on this, because there are times, and it may just be the weather and I'm sort of superficial like that, but there are times when I feel everything is going to be fine and my kind of fretfulness falls away, and summer is coming, and I sort of think people will come to their senses. But it does feel like it goes in waves, doesn't it? It's sort of 3 or 4 week periods where it ebbs and flows, and then there's a trigger, there's a new threat, or there's something, and then the sort of forces of increasing fear and increasing restrictions then get a kind of a new wave to ride on, and it tilts it all back. So I don't know how many of those waves we'll have left, but I suspect it's far from over, that story.
It seems to me the most recent kind of bout of mad ideas, which is, you're going to need to have a vaccine passport to go to Primark and this kind of stuff.
Yeah.
Over the Easter period, it seemed to be like every 12 hours there'd be another weird idea coming out from Whitehall. Never officially confirmed, but always kind of leaked out there. That didn't seem to be inspired by anything. I mean, there wasn't a new variant. All the vaccines were still going great. The case numbers were declining, to a lot of people's surprise. And yet they were still pushing this vaccine passport thing. And I genuinely can't work out why. I'm not really sure what they are hoping to achieve by having a vaccine passport in like September. I can get it now. I can get why the Israelis have one now, because they're opening up quite quickly and they want to do it safely. But we're opening up really slowly. And we're not going to have it when we actually open up. We're going to have it several months down the line. I don't get it. Do you?
I don't. And actually, maybe you can enlighten me on this one. I thought there was this herd immunity thing as well. I know that's now become this kind of poisonous phrase and no one wants to go near it. But I seem to remember over the last year that we talked quite a lot about herd immunity, and people argued from different sides about what the threshold was and how many people needed to be immune for it to work. But the whole idea was you reach a point at which enough people are immune that even if a small number of people have the virus and are wandering around infectious, it doesn't matter, because there are enough people around them who don't have the virus and are immune that the infection would trend downwards as opposed to taking over the whole population. That was, I thought, the idea of herd immunity, which means that if you're in a theatre or a football stadium and one person is infectious with coronavirus in September, October of this year, once 80+% of people have been vaccinated, it doesn't matter, because it will be
the R is going down. The R's below 1, right?
Yeah, the R is going down, and even within that theatre, you think of kind of concentric circles of people sitting around them. Enough of those people would be immune that infection wouldn't take over the whole theatre, which is everyone's kind of nightmare scenario. So I don't understand why we are no longer mentioning herd immunity, and this has become a kind of retired idea, because it seems to me that sort of removes the need for vaccine passports domestically anyway. Have I just misunderstood that?
Well, I know what you're saying, because I've been wondering the same thing. I think the answer is that there is this idea, and I'm obviously not a scientist, and I would love a scientist to explain this to me if it is correct, but there is this idea that even once you've been vaccinated, you can still get the virus, as it were, even if you don't get the disease, and you can still transmit the virus to other people. And they are doing research to try and find out where, to what extent that is true. Maybe there are diseases which do the same. I can't think of any. My understanding of something like measles is you've got quite a high herd immunity threshold, about 95%, because it's even more infectious than COVID. But I don't think as far as I know, I don't think you can sort of carry measles without actually having measles, right? You have to have the disease in order to transmit it, not least because the symptoms generally transmit the disease, right? The coughing and what have you. Now, I could be totally wrong about that. Please, somebody put the comment in the YouTube if I'm totally mistaken about it. That seems to be the idea, and that seems to be the basis of the models that come up with these really scary curves. Of 1,000 people a day dying.
Even with that, I still don't understand those models, and I really, obviously, I hope they're wrong for those people anyway. But I can't understand how they can be right. Because even if you are transmitting the disease, the overwhelming majority of the vulnerable people will be protected at that point. So even if you transmit it to them, they in turn will be protected. So yeah, I've found
basically, I think what they're
confusing.
assuming is that you have a massive outbreak, particularly among people under the age of 50.
Yeah,
and then they come in contact with pretty much everybody over the age of 50. And the vaccine is only, let's say, 70% effective. So 30% of those people die or become hospitalized. They're assuming that essentially everybody who hasn't already had COVID is going to get it in summer, as far as I can tell.
Yeah, which didn't even happen the first time around. I mean, I think we've got Johan Giesecke, the former Swedish state epidemiologist, one of the guys who kicked off the big kind of anti-lockdown movement, I suppose, when he came on UnHerd a year ago. He promised to come back in a year and account for himself, which he's now doing in later this month. And his view is, I believe, one of the things he admits he got wrong and feels differently about now is just how slowly this disease passed through the population. So both he, who thought we would be rushing to early herd immunity, and Neil Ferguson, who thought in his early models that this would just sort of immediately swamp the population and there'd be huge numbers of casualties very soon. They were both wrong, because actually it moved in a much more random and slow spreading way, and hit obstacles along the way. That's sort of the impression I've got, which again, I hope means that future outbreaks would meet similar impediments, whether it's this summer or this autumn.
Weren't the obstacles mainly non-pharmaceutical interventions?
Well, this happened in even in countries that didn't have many non-pharmaceutical interventions.
Like Sweden.
The whole idea of those early models was that it would basically everyone would get it pretty much straight away. And of those, 1% of people would die. And although it has, been a lot worse than many people hoped in a lot of countries, that scenario didn't happen in any country.
Yeah, pretty much. Yeah. Let's talk about Sweden, because are you half Swedish or fully Swedish?
Yeah.
Half Swedish.
I'm half. My mum is Swedish. Yeah.
And they're over in Sweden and have been for the whole pandemic.
No, yeah, they've been mostly, they're actually back in England now.
All right.
But they've been in the north of Sweden, safely tucked away, and have not had COVID. So
pleased to hear it.
Yeah.
I mean, like a lot of kind of libertarian-minded people, I was attracted to the Swedish approach, and around about summer, autumn last year, I think the thing that swung it for me was seeing how the curve, the curve of infections and cases in Sweden, it fell from April in almost exactly the same way, really, as in the UK, maybe a little bit higher at times. But I wasn't one of these people who thought, oh, this is purely seasonality or that Sweden's got herd immunity. But it did seem at least interesting that it wasn't going up in the exponential way that you would expect. And it gave me hope, I guess, that things were going to be pretty good. And come October, when our rates were going up again, Sweden was still very low. I thought, oh, I don't know what it is about Sweden, but it seems to be going well. But since then, it's kind of not gone so well. I mean, there's been 2 fairly big waves. Rates are quite high at the moment. And I still think they're a long way from herd immunity, right?
I mean, this is, again, probably going to be one of these things that people argue about for decades, because it's become sort of frontier in this battle. But it's, I think sort of, if you zoom out a bit, Sweden is still quite considerably far down the list from the UK in terms of deaths per million, down the list from, France, Italy, Spain, Belgium, all of the big Western European countries that did implement, as you call them, non-pharmaceutical interventions. And yet it's considerably ahead of Denmark and Norway and Finland. So make of that what you will. I mean, it's neither been an unmitigated disaster nor a huge success, I would say.
I mean, what I make of it is quite simply that Sweden isn't Britain, in the same way that South Dakota isn't New York or whatever. I mean, it's just, I think for me, the giveaway, again, talking about these, the graphs, the case numbers, the deaths, in that first wave last year, I mean, Sweden and UK essentially followed the same approach, didn't really do anything about it for quite a long time. And yet the number of people in hospital in the UK pro rata was much higher in Sweden before we locked down than, sorry, it was just much higher than it was in Sweden. And the same thing happened again in December, January, when again, December, we had stricter regulations than Sweden. And yet it was such a huge, exponential rise, cases doubling every couple of weeks. And we ended up, again, I think maybe twice as many people per capita in hospital. So we just have more infections. And whether that's because London's just a much bigger city than Stockholm or all the other factors, I don't know. And I'm interested to know. But for me, it's enough to know that they're just very different places. And for whatever reason, Sweden's kind of got off lucky with the infections.
I mean, got off lucky, but then not compared to Denmark and Norway. And, we spoke to the head of the health agency in Norway, who kept emphasizing, look, we've been quite relaxed here. She kept saying, people think we've been having this lockdown. We haven't really. It's been weirdly very similar to our friends, the Swedes, but we've had a totally different outcome. So the same sort of question happens over there. I mean, what's irritated me definitely is this constant sort of mechanistic comparison between countries, which is incredibly motivated in both directions. So, when Sweden's doing surprisingly well, all of the kind of lockdown brigade are listing all of the reasons why Sweden, of course, should be doing well. It's single households, they're also very spread out, and they have remarkable local culture, which is that they stay apart from each other in bus stops and stuff. All of these reasons were coming out about why the Swedes were never going to get it badly. And then they have a huge second wave, and suddenly none of that is true anymore. It's the opposite. They're now having a huge second wave because they didn't have a lockdown back in March. So all of that stuff, I think, is really just low rent. And it's been going on not just on Twitter, but it's going on in the newspapers. It's dominated the media conversation from people who should have known better, frankly. And the same, I would say, is true of the Asian comparison. We still don't know why all of those countries that surround the Pacific did so much better than Europe and North America and South America. We can speculate, But as you say, there could well be other factors that we don't know. They might be biological as well as to do with interventions. And yet there's this kind of constant drumbeat to say that, China and Singapore and those other countries and Taiwan and Hong Kong, because of their various measures, that's definitely why things have gone exactly like that for them. And there can be no other factors. So I just wish there was a bit more humility about this. And clearly the disease responds to all sorts of factors, some of which we understand, some of which we don't. And the constant sort of finger pointing, and you see this hubris and this kind of sneering attitude all the time about anyone who questions the sort of received wisdom on this stuff, which I thought, for me has been the least pleasant part of this whole last year, to be honest.
Yeah, and it's kind of natural that people are going to look at different countries and see the ones that are doing well, see the ones that are doing badly, and try and learn some lessons for it. And I agree with you. I think it's very unclear what the lessons actually are, even after all this time. But it works both ways. I get people going, "Oh, look at Florida all the time." Well, look at Brazil. I mean, look at you can always find somewhere in the world where things are going okay until it's not going okay anymore. It was India a few weeks ago. Oh, India's got herd immunity. Now look at it. It's absolutely off the scale. The interesting question, I think, is why is it that somewhere like India can go for so long with such low rates? Why is it South Africa had a huge spike around about Christmas? They've got the South African variant, obviously. Now I think things are going pretty well in South Africa. It's kind of intriguing why these places do go through these quite long lulls. They nearly always end up with a spike sooner or later, I think. But yeah, I mean, it's a mystery.
Yeah. And it's, I use the word mechanistic. It's a kind of naivety, and it's a government-centric way of thinking that, X policy is always needed to produce Y outcome. And as you say, there are countries where those kind of interventions weren't even possible, and yet they've had ups and downs, and they've had all sorts of movements without changing their government policy at all. And actually, it's made me into much more of a skeptic in the kind of philosophical sense about government being able to control everything, essentially. I don't think it's a reasonable or desirable goal of government to take a kind of total control of public health in this way, because it will just inevitably lead to more and more interventions and more restrictions, because they're chasing after a ghost, essentially. They're chasing after a level of control they won't be able to have. And that's why I think it takes us in a dangerous direction.
I think for me, in a nutshell, I would say that very often people do respond to the incentive of not wanting to get disease when things are going really badly. I think you could see that in Sweden in January, cases did fall once the hospitals were getting very full. The problem is that there's a bit of a delay between people's understanding of what's going on in hospitals and the rate of infection. So sometimes I think you do need that lockdown to add something on top of it. But actually, very often, I think you see this in America, people voluntarily respond in a way that prevents the hospitals being overwhelmed, but not always, So
and we see that within the lockdowns. Like, we're in our office building down the road is a lot fuller now than it was in the beginning of January. There's no change to guidance on working from home or not. Just people respond to the data and they, adjust their kind of risk profile, which is what I think they would have done anyway.
This is a question I asked Simon Evans on the previous episode, but I'm very interested to know what you think. What do you think we would be doing now in this country in terms of COVID policy if there was no vaccine and there was no immediate prospect of getting a vaccine?
I think we would be going towards what I suppose I would have favored earlier on, which is a bit more of a flexible, self-certified approach, where for those people who, whatever age, are worried about it and want to be protected, there would be continued help from government to enable them to do that, and including financial but also practical. But for those people who didn't feel worried about it, they would be allowed to carry on with their lives more. And I know that this will then sound like the Great Barrington thing. Aha, Freddie's a Great Barrington spokesman. Not quite, because there's, as I understood it, was a sort of forced protection of the vulnerable, which I wouldn't support, and then a kind of free-for-all encouraging people to go and get infected. I think gentle steps towards a more variegated approach could have been really effective. For example, shops at the very start of the year they had an hour at the start of the day where vulnerable people could come and shop in comfort, knowing that everything had been cleaned the day before, people would be ultra strict on numbers, everyone would be wearing masks, and then the rest of the day was normal. I thought that was a very sensible policy, and I think that same kind of idea could have been developed for a longer period of time. So you could have ended up with some pubs, or maybe some days for pubs that were open to everyone. And if you were vulnerable, you'd know it's a danger. Don't go to pubs on Friday and Saturday because it's going to be mayhem. But there would be Tuesday, Wednesday, Thursday, or whatever. All of the rules would be in place. So I think potentially we could have got to a situation which was more organically organized, and people who wanted to live life at different speeds could have done so in safety, if we had to do it for a longer period of time.
And is that what you actually think would have happened, or that's just
what I would have liked?
Or do you think actually we'd just be going in and out of lockdown for as long as it took?
Yeah, I mean, I just don't know. One of the things I definitely got wrong was the public appetite for this stuff, because I really thought that they would get bored of it and there would be a sort of cry for liberty at some point, and that just has not happened.
Why do you think that is?
I think people are more attracted by being told what to do than I thought they were. I think there's something quite sort of existentially reassuring about your options being limited in a way. You're to live a full sort of dangerous life where you're out there constantly is quite sort of exhausting, and there is something quite appealing about having your sort of options constrained, and I think there's something like that going on because people seem to quite like it.
That's quite a depressing answer. I would have said it's probably just basic incentives, really. People being paid to stay at home. People who don't like commuting don't have to do it anymore. They see more of their family and their pets and so on. And also that they're scared. I think probably the government has excessively scared people. I don't think it's been quite clean with the statistics. Whenever you watch the news about it, if they show somebody dying from COVID, it's always somebody under the age of 50, rather than at the age of 82, which is the average and so on. So probably people do have an exaggerated sense of risk. Plus, they've got perverse incentives. If the government wasn't furloughing everybody and keeping all these businesses afloat, surely public opinion would be very different.
I think yours is a much more sensible and convincing policy-based answer that I probably should have given, but I would, I feel like there's this slightly more ephemeral thing going on at the same time, but I don't disagree with that.
Oh, good. Well, so I think it's slightly more. I mean, they're both fairly pessimistic answers, really, because they're both kind of.
Can I ask you a question before we run out of time?
Yeah, please do.
So one thing I take issue with you is your sort of campaign against the fruitier members of the lockdown skeptics. The smileys. I just don't know what that has really achieved, to be honest. So I understand that they were peddling misinformation, etc. But they are not powerful. They are little people. They're weird people who've come out of nowhere from during this pandemic and will no doubt recede back to that after it. They're not influencing government policy, despite all of this crazy attempt to suggest that Boris Johnson is listening to kind of, conspiracy theorists and pursuing herd immunity strategies, which he has never done. So I just wonder, why give them so much energy?
Well, partly because they're not all little people. Some of these people are grifters and they're making quite a lot of money out of vulnerable people along the way. I have had a fair few emails from people thanking me for kind of banging on about this because they themselves got sucked into some of this conspiracy stuff a few months ago, and now they see the error of their ways. You're right that they don't have a lot of influence on policy, but there's more of these people than you might think. And potentially, if they start to believe that the whole thing's a hoax or it's not that dangerous or whatever, they start undermining the lockdown. It's not an issue now, but back in January, it was an issue. People are going to start going off and pretending the virus doesn't exist, and they start putting their own health at risk and the health of other people's at risk. But mainly, to be perfectly honest with you, it's because they were abusing me all the time. You know, if it had been zero COVID people sending me endless hateful tweets, I probably would have gone to war on the zero COVID people, but they haven't given me any grief at all, particularly. The government wasn't giving me any grief in the first couple of months of lockdown. People kept saying, the Smileys kept saying, why don't you go after the government? They're the ones who are causing the problem. I agree with the government's policy, I'm afraid. I do think we had to have a lockdown. When that started to change, now I'm gunning for the government more,
Because when I would say that if we're looking back at the history of the year, that in the UK political conversation was actually quite a significant moment, because it meant that, you and I would consider myself in that group, were one of these sort of hopefully sensible, skeptical people. Corona-centrists, self-anointed. But, when you sort of turned on them, it meant that the net effect of it, I think, was to make any kind of skepticism seem dangerous, and that it was going to be kind of grouped with the crazies. And I think a lot of people would have stepped back at that point.
Well, there wasn't very much sensible skepticism left by that point. We're talking like middle of January, I wrote the article for Quillette about the coronavirus cranks. I didn't see a lot of sensible skepticism around then. It was purely about, false positives and PCR spin cycles, and there aren't any excess deaths and all this kind of stuff. I mean, I think you kind of said to yourself, it was kind of dead by then. And I think, unfortunately, it was.
So you're going to carry on at old Ivor and who is it, Mr. Yaden? Are they? When will you let them?
Mr. Yaden's left Twitter and is now saying that the vaccines are designed to wipe out half the world's population. Or something. Right. Cummings is still going; he's still making money out of it. Some of the stuff he just says is so hilariously wrong that it's very difficult to resist poking fun at him. Occasionally, this is not my full-time job, I should explain. But yeah, sometimes people poke me and I poke them back. They're a worthy target, I think, but I agree with you. They're almost totally powerless compared to the government. And Matt Hancock and Independent Sage, or Normal Sage, or whatever. Why was Independent Sage formed? I was trying to remember the other day. Was it actually because they thought Sage wasn't hardline enough on lockdowns? That feels right to me, but it doesn't make any sense.
That was it, I think.
Wow, that's amazing, isn't it?
It's gone through a few. I mean, we had Carl Friston on our YouTube show, and I did a whole piece about his thoughts about circuit breaker lockdowns and how they were going to miraculously fix coronavirus forever.
That turned out to be
I got quite excited about that. Turned out, sadly, it didn't work.
Yeah, test and trace turned out to be false dawn as well, didn't it? Really. A lot of this stuff people were saying last year, we just need to circuit breaker lockdown, get rid of the problem for the time being, wait for a functioning test and trace system. Never worked. People don't isolate. Freddie, it's been great talking to you. I'm afraid we're out of time.
Yes. Well, next time let's do it in person.
Yes, absolutely. I look forward to seeing you sometime in London very soon.
Nice
Take
one.
care.
Thanks, Chris.
Thank you very much.
Cheers.
And thank you at home for watching again. I hope you take care until the next time. If you want to donate to the IEA, please do so. iea.org.uk/donate, and tune into our very busy online schedule. I shall see you soon. I'm interviewing Matthew Said next Tuesday. So tune in for that. Until then, ciao.